Hi, it's Dr. DeCubis of Main Street Chiropractic. Today, I wanted to go over an important subject that I don't think most people realize and understand, so I want to make sure that I get out there and talk about it a little bit. And what that is that what you really should be doing after a car accident. Now, the biggest thing is most car accidents are going to be fender benders, rear end collisions, type of things like that, not totaling your car. But it's important to make sure that you actually get yourself checked out properly. The first step is always going to the ER, but also following up with your primary care doctor or even with a chiropractor. And the reason for that is when we have these types of injuries, a lot of times your body has whiplash or something else like that where the seatbelt's restricted you and part of your body's moving forward and moving back. And the problem is that a lot of these injuries don't show up for a couple of days or maybe even a week. You start feeling a little sore, you don't notice too much, you think it'll just go away. And the problem is that it doesn't. Your body's actually been injured, and that is the way you're feeling that injury is through that soreness, and then it starts to get worse. Also, especially if your head is impacted anything, whether it even be the back of the seat and it hit that very hard, or the windshield or the side mirror, you want to make sure you get it checked out because if there's anything going on, the sooner you find out, the more likely you are to get a lot closer to 100% than if you wait 2, 3, 4 weeks. And it's really important to know what you're dealing with. I've had many patients that come in, they've had chronic issues in their neck. They say, Doc, I don't know what's going on. After we do a history, we find out that they were actually in a car accident 2 years ago, and they had an injury that was never diagnosed because they never got it checked out. They thought they were just sore from the injury, and now unfortunately we're dealing with something that we're not able to get to heal as well as if I would have seen them 2 years ago. So it's always better to be safe than sorry. You want to go in, get it checked out, and you want to have someone tell you, I don't find anything, don't worry about this. What you don't want to have happen is say, I wish I would have went in 2 years ago because now I'm dealing with something that I may have to live with for the rest of my life. So my advice to you is be safe, just go and get it checked out, make sure that you're okay, make sure the passengers are okay, then you can have peace of mind. But if you're having any sort of symptom, that means that something's wrong. No pain is normal. No one should ever be in pain. And when you put that with an accident too, you need to be very, very careful and make sure you get to the root of what's going on. So I hope that helps. And again, just make sure that you always are very, very careful. And imagine if there's a big dent in a metal bumper, what did that do to the soft tissue of your neck or your back? So again, I'm Dr. DeCubis, and if you do have any of these issues and you would like to have us check them out, no problem. I'm more than welcome to do that. You can either give us a call or you can send us a message or you can even set up an appointment on Facebook. But just make sure you get it checked out. I'd rather you go anywhere than nowhere. All right, thanks a lot.